Good morning. Thank you for joining us today. I'm LuAnn Heinen with Business Group on Health, here today with Brian Castrucci of the Beaumont Foundation and Ron Goetzel of the Johns Hopkins Bloomberg School of Public Health. Welcome to you both. We're here today to discuss a report the two of you collaborated on, just released, 7 Ways Business Can Align with Public Health for Bold Action and Innovation. Now, this report offers strategies for business leaders to strengthen the health of communities and help ensure America's long-term economic prosperity. Brian, can you tell us why the Beaumont Foundation, the nation's largest foundation focused on state and local public health, is interested in fostering collaboration with business?
Throughout the COVID-19 pandemic, we've lost 500,000 American lives so far and 100,000 businesses. The pandemic has laid bare the inextricable link between our health and our economy. At the Beaumont Foundation, we want every community to achieve its optimal health, and we know that every business has a critical role to play in achieving that goal. In the video you just saw, Larry Fink's letter to CEOs echoed this belief and pushed it into the broader public discourse. Right now, we need business leaders to help promote vaccine confidence and to support mask wearing and social distancing. As we move beyond COVID, we look to business leaders to use their political influence to address systemic inequities and rebuild our public health infrastructure because they know that good health really is good business.
Picking up on Brian's comments, Ron, what are the top 1 or 2 things business leaders should be thinking about doing right now?
Yeah, thanks, LuAnn. So if you think back to the spring of 2020, we were all facing massive crises. We were all suffering. So with the support of the Beaumont Foundation, we asked, what can we do now to address these many crises? And as importantly, what can we do to avert future crises because we know they're going to happen? So coincidentally, in the previous year, the spring of 2019, we released a report with the Bipartisan Policy Center that made a very strong business case for business and public health collaboration. That was even before COVID-19 hit. One recommendation from that report was that public health needs to prepare a clear and concise ask of business and also explain what's in it for the typical business owner. So in the summer of 2020, as the pandemic was raging, we brought together 40 business and public health leaders, including executives from Disney, Goodyear, IBM, Sodexo, USAA, and discussed how to articulate that ask. We said, tell us how can the business community support public health in this fight against COVID-19, and how can we collectively prepare for the next crisis? So the report that we released on Tuesday answers that question with 7 broad recommendations, along with some very specific actions where businesses can take the lead. And to summarize the top 3, number 1, put out the fire of COVID-19 by amplifying and reinforcing credible and scientifically based guidance. It turns out in the United States, people believe their employers more so than they do the government. Number 2, improve the health and well-being of your employees so that they are better protected against the virus as well as non-communicable diseases like diabetes, heart disease, cancer, mental health problems. Employers can do a lot by sponsoring evidence-based workplace health and well-being programs. Number 3, improve the health of your communities. Help your communities become more livable and resilient. Partner with your public health agencies. So we had 4 other recommendations in the report, along with concrete action steps that employers can take.
So, Ron, you've spent a good part of your career working at the intersection of business and public health. Why is this time different, and how can we make sure that the economic impact of lack of preparedness never happens again?
So, LuAnn, I think it is different now because we're all feeling the pain. And business leaders recognize more and more the link between public health and the economy. They're leaning forward and embracing their corporate social responsibility by addressing broader societal issues. Make no mistake, businesses are still accountable to their shareholders, but many leaders also now recognize that they're accountable to their employees, communities, and customers. They're seriously thinking about how their business practices affect these other stakeholders' health and well-being. And by the way, being socially responsible may also help them from a purely financial standpoint because demonstrating that you care about your people and communities, you attract top talent, motivate employees to be mission-driven, improve your brand, and you may even bolster your stock price as a result. And we even have some research showing that.
Okay, so we've heard why business and public health should collaborate and some ideas for how they may do that and take action together, especially in the shadow of COVID-19. Brian, looking ahead, what does alignment between business and public health look like, particularly when we're no longer dealing with the pandemic?
We are going to need to reckon with the understanding that to some degree, the devastation that we've seen as a result of COVID-19 was preventable. Decades of underinvestment in our public health infrastructure and systemic injustices have created vulnerabilities that must be addressed. We need to recognize that our nation's safety, security, and economic prosperity are dependent on us making transformative change. Now, during COVID-19, businesses have stepped up. Manufacturing plants have taken to producing masks and hand sanitizers, and restaurants have turned into community kitchens. Many businesses have offered marketing, technical, and logistical expertise to support vital public health and vaccine distribution campaigns. These, though, are short-term fixes. I look forward to working with business leaders who realize long-term change must lift up our public health system and address socioeconomic disparities and racial justice. We can do this by strengthening partnerships with local public health departments, pushing policies that impact deep-rooted disparities, and advocating for a modern public health workforce. Together, business and public health won't just get us back to normal, they're going to help us build back better.
Well, that's a call to action. Thank you for that, Brian. And it's a wrap. Thank you for joining us today. Please be sure to check out the new report at beaumont.org. And now we'll turn it back over to the Washington Post.